table. So you're just pressing your low back into the table. As you posteriorly pelvic tilt, what's that doing to your lumbar spine?
Flexing it.
You're flexing it. Exactly. Okay? So we can strengthen your abdominal muscles into a posterior pelvic tilt. We're strengthening the anterior musculature, stretching the posterior musculature to help you strengthen your lumbar flexion. So very basic. We also talked about Kegels last term when our pelvic section came up. So that may be where you start. We're kind of starting the next level above that with this section. Okay? Transverse abdominis and pelvic floor stabilization. So remember, let's find your ASIS on both sides. So put your fingertips on it. Now I want you to slide your fingers in and down just slightly, and imagine a belt of muscle running from hand to hand. Okay? You're going to gently try to tighten that belt of muscle. Keep breathing. You're not sucking everything in. Remember, we're thinking about visualizing gently pulling up and in at the pelvic floor. We had mentioned last term slowing the flow of urine, stopping yourself from passing gas, things like that. You're just trying to gently pull up and in, tightening that muscle belt that runs transverse or across your torso. Okay? And I believe when we talked last term, you mentioned, Brian, the norms for a male to hold 20 full seconds, still breathing and holding that as a 5 out of 5.
That's hard work.
It is. It is. So patients have to work up to that. So these are all basic, but they can still be kind of frustrating. But that's going to help us with flexion, because if you're pulling across there, that's going to help strengthen us being able to hold. The anterior thorax is nothing but muscle. Remember, the posterior, we've got our spinal column, so we've got support there. But to strengthen, we need to get the anterior musculature engaged when we do movement. So this is going to help us stabilize or strengthen in the flexion direction. For extension, now let's do an anterior pelvic tilt. So hands on your iliac crest. Remember, this time you're going to try to lift your low back off of the table. You're tilting your pelvis forward, so you're arching your low back. So we're engaging all those small little muscles that run along the spine on the posterior side of the thorax. We're engaging the extensors. We're strengthening the extensors as we do an anterior pelvic tilt. Okay, we're also using the hip flexors a lot. That's going to happen because they're a force couple when we move. But we can engage the lumbar extensors by doing an anterior pelvic tilt and focusing in on using those muscles to lift and arch our low back off of the table. Okay? So the multifidus training you'll see listed on here. It's a little bit tricky for most folks. If you remember from your reading, the multifidi, that's our plural form. Multifidi stretch 2 to 4 segments in length. They kind of overlap and stretch 2 to 4. These guys are really important, but they're very, very small. So to try to engage those, I have a couple of different ways. Let's have you roll over onto your stomach for just a second. So if your legs are hanging out, that's okay. We would normally be on a floor or on a table where everything was supported. You want to lower all the way down so you're not on your elbows. So what we're going to do here is we're going to visualize, and this is very important as a therapist that you're giving some tactile cues. So I'm always going to take my thumb and index finger, and I'm going to put that along both sides of the patient's spine. So, right, I'm just going to put my hands right here on both sides of your spine. Okay, so I'm giving a tactile cue. And yes, you can do that to yourself. I don't do it a lot with patients when they're first training, because just by moving your hand back there, you can see you already bias yourself to a rotation. So just putting your fingers along somebody's spine just to give a little cue. Now, what I want you to think of is we're going to do one leg at a time. I want you to think of a 500-pound weight on your right ankle, and you're going to try to lift up against it. So it's an isometric exercise. And when you try to lift up that leg, I feel the multifidus fire underneath my fingers. Okay, so these muscles engage when you're trying to lift that foot. And then you would relax, and then we can do the other side. Same thing. I've got my fingers on the side of the spine. All right, that weight's now on your multifidus training. You're trying to train those small little muscles. You're not doing full leg lift, because then you're getting what muscle? You're going to get the big house. You're going to get the glute max and your hamstring involved. And look how big those are, some of us more than others, compared to our small little multifidi muscles along our spine. That's why our backs hurt all the time, because our bigger muscles will take over and pull on us and get us into positions that we shouldn't be in. So we need to down train, and we need to train those smaller muscles to hold the spine in a good position as we do our movements and the larger muscles kick in. Okay? So definitely practice some of these with people, because it's hard to get, and you need to have good palpation skills to actually feel the muscles engage underneath your fingers, and watch their glutes to make sure that they're not just engaging immediately, that the glute just doesn't kick in and lift immediately, that you're trying to get the bifidi to do their thing first. Okay, so let's have you back over into hook line. So these are bent. We're going to talk about rotation now. So most of our exercises, you're going to notice, they're stabilization exercises. There's not a lot of movement going on here. We're stabilizing. We're trying to train our spines to hold still while we move our other larger joints that are meant to move if we're using correct body mechanics. So in order to help us with our rotation strength, we need to stabilize in rotation. So as I walk, I'm not doing a whole lot of rotation. As I go to lift something, I'm not cheating and doing a whole lot of rotation. So that means we're going to try to hold our bodies and resist rotation. So your initial step would be the Kegel, turn the transverse abdominis on, and then lift your right knee. Okay, so just lift it to about 90 degrees at the hip. Now take your left hand and place it on the top or the front of your knee, so just superior to your knee. And you're going to resist a rotational force, so press diagonally. So opposite hand, so left hand on your right knee mark. There you go. So diagonal motion, so it's your contralateral hand and knee. And just push hand into your knee, knee into your hand. Breathe, Kegel is on, hold for a few seconds, and then you relax. So we're engaging our obliques. We're engaging in a rotational manner, but we're trying to stabilize, so hold ourselves perfectly still. No rotating here. So this is the basic version. There's not much movement. You're going to slowly lower back down. You engage the muscles, so Kegel first, transverse is on. You lift the knee, place the opposite hand, ipsilateral hand on the inside or top of your knee. There you go. And you're going to resist rotating. There you go. So the hand should be on the inside or front of the knee, medial knee. There you go. You're not trying to pull yourself into a stretch. You're trying to press your hand into your knee. There you go. I think everybody's got the right hand placed now.
Is this still intermediate? Is this basic or intermediate?
So not much movement here. And this is something that we can work up to an advanced exercise using that stabilizer. The little blood pressure cuff looking thing. We can press up the pressure, the air pressure in there, and your goal is to hold it still while you do this type of motion, and so that's making it much more advanced, much harder. Okay, so we're resisting rotation to stabilize our bodies to make us stronger in rotation as a basic exercise. Okay, and then if we want to work on lateral flexion, all we have to do is a hip hike. So lower one leg down so it's straight. Okay, and actually keep it knee extended if you can. And all I want you to do is put your hand on your iliac crest of the straightened leg. And I want you to try to lift that iliac crest up towards your rib cage on that side. So it's pulling it up towards your head or your shoulder or your rib cage. Engaging the QL, engaging your obliques, and then relax back down. Okay, so I tell people, imagine you've got a string through your leg, you're trying to pull your hip socket together, and then you're trying to pull that hip, that iliac crest up towards your rib cage. So all of your movements should be horizontal to the floor here. You're not letting them engage the hip flexors and flex that hip or leg off of the floor. certain Pilates and yoga type exercises that involve some of this strengthening and elongating. So if someone is tight in that area, Brian already showed you a little bit of elongating, so you can have someone do the hip hike and then have them stretch it back out by pushing the foot further away from them, and think about elongating that area now. So those are your basic exercises. Now come back to your hook line position. Both knees are bent. So when we did our manual muscle testing for trunk flexion, we were really just trying to clear the inferior borders of the shoulders, shoulder blades, the scapula, off of the table. So you can have someone do a basic crunch or an intermediate exercise by just having them start at the grade 3 position with their hands and just trying to curl the head and shoulders up off of the table. Basic crunch there, okay, and then lower back down. So they're just reaching with their hands towards their feet. You just want them to clear the inferior borders and no more. If someone is coming up further, as we mentioned earlier, they're engaging hip flexors, so they're getting the iliopsoas involved, the rectus involved, and then maybe they've got some stiffness through the thoracolumbar spine that we need to work out before they can do, real crunch. Brian showed you a couple of clinical curls as far as, Maria, I saw you doing it, Rant, with your knees rotated out to the side. If for some reason someone's kicking in a lot of hip flexors, you can rotate the knees out, but keeping it a small motion. Yeah, Mackie?
Does it change it if you have your legs up?
It does, and we're going to talk about that when you do your lab manual exercises. We were going to talk about it today because it's in there, but we're going to get to that in your lab manual exercises, definitely. Hook line position is the most gentle on the back, too, so just think about if you have someone with their legs out straight, that's going to put more torque on the back. They're going to be arched, so we want to, if we're trying to strengthen flexion, we want the back to be in a neutral position, not arched into extension. Yeah, Patrick?
What if when you're doing these exercises you feel one side activating more?
Then we need to draw their attention to that and have them palpate and have them start engaging and thinking about that side more so. And we can keep working on that. Sometimes people have a muscle imbalance where the eye is slightly rotated, or maybe they've had a surgery or something on one side, or an issue on one side where there's some weakness. So we'll down train and we'll probably take them back to more of the transverse abdominis, the smaller, the lower level activities, and then build them back up to try to get them even. I've had certain exercises, especially with multifidus, where I use the electrical stimulation. I'll put the NMES unit on them, so they're getting engaged on that one side that's not firing correctly, and that will help boost that side to get them even. So we'll pay attention to that, take them back down, and try to build them back up. Okay? A lot of it is awareness, so if you can get the patient to self-palpate while they're doing this, try to get them both equal, that helps a lot. Otherwise, your body's just going to cheat and keep doing it the way that it knows how to do it, because that's the easiest for your body. Good question. All right, so let's have you, while you're in that position, let's have you roll over into prone again. So to build some extension strength, you can have someone do a hyperextension exercise from this position. So just like our manual muscle test again, you can have someone lift their chest up off of the table. So to make it easier to start off with, hands at your side, just have them gently lift. Okay? And relax. You can put a pillow at their chest so they don't have to lift so high up. You can have them bring their hands across their chest, just resting on the table, and have them lift from there. Sometimes they'll have people with their hands to their forehead. I don't necessarily like to have people put their hands behind their head on this for some reason. I'll have them at the front of the forehead. Or you can have someone do a hyperextension of the spine, working those extensor muscles just from a prone position. We'll come back to the body blade here just a second, because that gives a lot of different things.
Hey, Beth.
Let's have you turn over onto, Shelly.
Do you instruct to have them not fire their gluteus maximus?
Not fire their glute.
Yeah, to relax, or is that alright to have that part
It's really
working as part of it?
It's possible to have someone not fire their glute when they're trying to stabilize, so I will tell them to concentrate more on the spine, but
Okay.
But I will if I need to. I typically don't stabilize their legs though, because I want them to just work on lifting in their smaller range of motion, just their own body weight. So I'm not putting my hands on their legs where they may tend to engage their hamstrings and their glutes a little more so. Mark's doing the both ends, so that would be a little bit more intermediate to advanced, where you're lifting the feet and the head at the same time. So you're getting a lot more extension motion there. So definitely more of an advanced exercise for most of our population, especially those of us with tight hip flexors. Okay, so let's have you turn over onto your side. Knees flexed. So you can do the side crunch like we did with our manual muscle test and have someone reach up and across their body. So that one you've already done with your manual muscle testing. But you can also do a plank. So in order to help stabilize the spine, it's a challenging exercise, but you don't move the spine as much. You can do a plank position. So what I'd like you to do, if you can, in your positions here, try to straighten out your hips so you're at a little bit more of a straight position. There you go. Okay. And then I want you to try to be on your elbow. There you go. Now you're just going to raise your backside up off of the table. This table's already doing it. Raise your backside up and make a plank. So you're making your spine a perfectly straight line. Just use your elbow.
Your knees are
there you go. Knees are bent, but you try to keep your spine and your hips as straight as possible. So you're not cheating with your hips flexed. Okay? So you would prescribe a certain amount of time. So 5 seconds to start off with, and then lower back down. But you have to keep a nice straight position. If you're flexing through your spine, if you're rotating through your spine, it's not doing its job. You want to keep, they call it a plank because it's like you're a board. You're going to be a straight board. So this is at your knees and your elbow. You can make it harder by straightening out your legs and doing a plank from your elbow and your feet. Then you can progress to make it even harder. Instead of just going under your elbow, you can go onto your hand. Then you can do one hand, one foot. You can reach and do swirls and all kinds of great things with your other leg. And then you're discharging physical therapy.
It's a plank.
For most people, trying to hold a side plank or front plank for a minute, 1 or 2 times, is a serious workout. So usually I'll have people start with 10 seconds, do a few of them, work up to 30 seconds. When they get to the minute mark, they're getting pretty good. Okay, but these are a type of yoga and Pilates motion as well that you'll see done in a lot of different programs. These are very, very good for stabilizing the spine. And even though they're hard, they're not nearly as challenging and strenuous on the spine because I'm not forcefully rotating myself, I'm not forcefully doing something, I'm not adding extra weight, it's just my own body weight. And some of these things can be pretty functional. I'm trying to get up off of the floor. How do I get up off the floor? I need to use some of these motions and some of these muscles. What does that side plank look like to you? If you're trying to get someone out of bed, they're kicking their feet off, they're pushing up onto their elbow, they're pushing up onto your hand. Hey, that is supine to sit. That's sit to supine. That's all that is. You're just making it a little harder because you're having them keep their legs in position and hold it longer. But that's all